Well, it's a trifecta of black girl magic. Three female pharmacists are using the power of social media to educate the African American community. And they are here with us today. At least two of them are Dr. Courtney Jones and Dr. Sylvia Miller, along with Dr. Leah Miller, Sylvia Perry, I should say, along with Dr. Leah Miller, are the creators and hosts of Three Friends Talk. It's a weekly podcast devoted to informing and entertaining our community on health topics. And once again, we have two of the trifecta here today, Dr. Courtney and Dr. Sylvia, joined us from Dallas, Memphis, and Atlanta. Well, Dallas and Atlanta, I should say. Thank you for starting your day with us, docs. Appreciate your time.
Good morning.
We're happy to be here. Thanks for having us.
Well, good to have you. Let's start from the beginning. So before the podcast, how close were you guys? Were you guys friends? Is that how it all came together? You say, girl, we were sitting around, we talking about these issues. We might as well put this in a podcast and share this with the world.
Were you there,
Dr.
Mike?
Courtney.
That's exactly how it happened.
Pretty much.
Yeah.
It's actually a neat story. So
Tell us about it, Dr. Courtney.
Friends. We were already friends. We went to college together, pharmacy school together. So this is 20 plus years of friendship here. And we actually took a girls trip in 2019 to Cabo. We had not taken a girls trip before. So this was a great opportunity. And let Dr. Sylvia tell it. She was like, we're going to start a podcast. So Dr. Leah and I were like, okay, sure. We're going to have a good time. It's some self-care. And Dr. Sylvia wants to start a podcast. So I need to throw this part to Dr. Sylvia because lo and behold, she pops up with a microphone. So Dr. Sylvia, you want to tell them what since then?
Yeah, we sat down one day and started recording and never stopped. And here we are today, heading into our third season. We just completed our first live event, and it's all been going very well and really has been touching people.
And, and it's needed, Dr. Sylvia. Let's just be honest and serious about that, because we need to know more in the black community. There's a lot of misinformation out there. There's a lot of things that's happened to us as black people in the past when it comes to the medical profession, even in the pharmaceutical industry. So give us the overall mission that you guys want to address, the message that you want to put out for your listeners.
Yeah, we're all about authentic conversations about health, friends, and fun. From spiritual health, physical health, mental health, all of the ways we can stay healthy. But it doesn't have to be boring, because we have to incorporate this in our lifestyle. And guess what? If it's boring, we're not going to do it. So we try to have those important conversations and also make doctors more accessible, right? Our community has been through so much with the medical community, but there's a lot of us in the medical community. So if you can hear it from somebody that looks like you, maybe the second time you hear it at your doctor's visit, you'll say, oh, okay, I've heard this before, I understand it, or I know how to ask questions about this to get what I need. And we've seen that with people going to seek mental health, people requesting us to talk about kidney disease and all kinds of things. So we're thrilled.
Yeah, I like those topics, especially the mental health aspect there. Dr. Courtney, she brought up something Dr. Sylvia did about talking about medical terms and not being boring. How do you do that? I mean, because a lot of doctors can be boring. Like, it's almost like reading the American Journal of Medicine and just kind of how do you do it? How do you make it exciting for your listeners to listen to and make it relatable so that, they can be a little bit more interested in their health and in the medical profession?
Absolutely. So, we learned to take the white coat off. When we're talking to family and friends, it's just us, right? So we have to make sure that we're treating our community just as though we were related or friends, and just be ourselves so that authenticity does come out. Just because we have pharmacy degrees and we've gone to professional school does not mean that changes who we are in our core. And so we are truly, charismatic women who really just talk down to earth. We understand, of course, the medical jargon, but my mom may not understand it, right? So I have to talk to her as I would as her daughter. So she understands, just layman's terms. So we treat our audience the same way. So, and we all have different personalities and it shows. So we like to bring that out as well to show them we're just like you. So Dr. Sylvia, she may like to sing. I like to dance, get up and dance all the time. And
Hey,
Dr. Leah, she's a libation. So we always incorporate some kind of fun in there. But yeah, we
did you
just
say
talk to our
libation?
audience. Yes,
Oh,
she
oh,
makes
well,
all the
I
drinks.
hear it's good for you. It's good for you. I mean, like they say, a couple of wine,
That's
you know, a
what you
couple of
hear.
cups of
Red
wine,
wine
glass of
does it
wine.
for you.
Yeah, that's good for you. So who's the
Absolutely.
one that goes there and the two of you guys got to bring them back? Which one of you guys is it? You know, Dr. Leah's not here, so maybe that's the reason why she couldn't get up this morning. No, she had to go take her kid to school. I understand that. She was doing the libations while she ain't here. But who's the person? Which one of you guys is the one that okay? We got to bring her back because she's going there.
It's definitely Dr. Courtney. A plus plus plus.
Oh. What
Look,
about
I didn't
Dr.
want to
Courtney,
say it.
Dr. Sylvia, that makes it go there? What about it, Dr.
Well,
You can
Sylvia? What
never
about Dr.
tell.
Courtney?
She just
I
is
have
so
certain triggers.
charismatic. You never know what's coming out of her mouth or whatever she gonna bust into a New Orleans bounce move. It's just okay, and we just sit back and enjoy it. But that's the beauty because this is our show. We can be exactly who we are, and it's kept us friends this long. So why change it now? We all went to Xavier University in New Orleans, so we just want to send them some love. They're
Yes,
going through
yes,
the aftermath of Hurricane Ida, and we're there to support them in
absolutely.
whatever way we can.
Yeah, the students will be
All
headed
right,
to you, Sylvia.
absolutely, and we definitely want to send our love as well. Before we let you go, and you know we have fun, and I know you guys have fun, but there are certain things that need to be addressed, like you brought up the mental health issues right now. We're going through COVID or whatever, and you know, how do we get through to people who may not still understand about the vaccine, about COVID-19, about some of the misinformation that's out there? How do you guys address that in a manner that is entertaining but serious enough so that they can get the message? Dr. Courtney.
Absolutely. So we want to provide education. We're not trying to sway you one way or the other. But if you have real questions, we're going to give you the facts and not sugarcoat it. You know, if we see something that is working and we believe in the science and we understand the science, we're going to educate you in a way that you do understand it. Let's if we have to do a visual or a model of this is what how the vaccine works and this is what it's going to do, we break it down to where it's really understandable. And so we give examples to relate it to how these things have worked in the past, how we've had to go through pandemics, years, even probably before some of our times, and
Mm-hmm.
really show them this is what the result was for our community and so forth. And we understand that there are so many healthcare disparities in the African American community, but where are we now? And what are we doing? And there are
Mm-hmm.
so many healthcare professionals that look like us that you have to really get the information from someone you trust. So that's where we would start. But again, you know, if they
Yeah.
are hesitant, we try to, you know, not make the mood so uh, you know, I guess glim or try to just uplift at the same time with
Mm-hmm.
that positive spin. So, yeah, Dr. Sylvia, what else would you say?
I just try to make it very plain. This has come up again. We're really excited about the FDA approval of the Pfizer vaccine. It's gotten in a few more people. Dr. Courtney says we're not trying to sway. Let me be clear. I am trying to sway. I want every person I know to
Yes.
have this vaccine because it's our best way of fighting against the COVID 19 pandemic, the after effects, all the things, the long COVID. And this is the most studied vaccine we've had since the beginning of time. I know it didn't go the traditional timeline. It went through
Mm-hmm.
all the traditional steps, but now we have so much data and information that I really try to get to the heart of why people are not getting the vaccine. And a lot of times I can sway them or show them a different perspective, but we won't give up and we won't stop
Yeah.
encouraging our
And,
people and everyone to
Yeah,
get vaccinated.
we're going to keep educating.
I'm glad you.
Absolutely.
Yeah, we got to keep doing that, Dr. Sylvia. I'm glad you said that as a pharmacist that this is not something new when it comes to that vaccine. We got to go, but we're definitely going to check you guys out. Three Friends Talk available on social media. We got medicine, we got dancing, we got tea. May have a little libation in that tea as well. Dr. Courtney Jones,
For
Dr.
sure.
Sylvia Perry, the creators and hosts of the Three Friends Talk podcast. Thank you so much for starting your day with us and giving us that information. We're going to check you guys out.